before this, I would wash my hands to make sure they were clean, and then I don't have gloves in the apartment, but I would put them on before I do the assessment. Hi, my name is Tristan. I'm going to be your nurse today. I'm going to be performing an assessment over your head, eyes, ears, nose, and your throat. Can you confirm your name and date of birth for me, please?
Yeah, Savannah Berry and 9/15/99.
Nice to meet you, Savannah.
Nice to meet you too.
Have you ever had an ear infection?
Nope.
Have you ever had a sinus infection?
Nope.
I'm glad to hear that. Alright, so the first thing I'm going to do is I'm going to check your facial positioning. So I would say the shape of your head is normal cephalic. I would say that your features are all aligned symmetrically. Can you raise your eyebrows for me, please? Can you smile? And can you squint your face for me, please? Thank you. So the next thing I'm going to do is, do I have permission to touch your head?
Yep.
Thank you. So I'm going to feel around up here. I'm going to palpate for any lesions, any, I'm checking the hair distribution too to make sure that it's even. And it seems even, there's no bald spots or anything. I don't see any parasites up there either. I didn't feel any. So after that, I'm going to check your eyes. So the first thing I'm going to do is, do I have permission to touch your face?
Yep.
I'm going to check your conjunctiva, sclera, and irises. The conjunctiva look moist, the sclera looks white, and the irises don't have any like abnormal color, they just look blue. So after that, can you stare straight ahead at that wall, please? Thank you. It's malfunctioning right now, 1 second. There we go. Alright, so they constricted when they saw the light, and they dilated when the light was turned off. They dilated evenly together. So after that, I'm gonna, can you cover one eye for me, please? Thank you. Can you remove your hand? Can you cover the other eye for me, please? Thank you. Can you remove your hand? Perfect. So they didn't stray away when the hand was removed or placed on. They look straight forward all the time. So now, can you follow my finger for me without moving your head, just with your eyes?
Yep.
Thank you. Perfect. They're moving evenly, and one wasn't moving different than the other one was throughout the whole process. So next, I am going to check, I'm going to explain to you what PERLA is. So it's your pupils are even. I would rate them, their size-wise, like a 5. They are round. They reacted to the light as we saw. And now I'm going to check the accommodation of them, which is like how they move together when something gets closer to your face. So can you watch this finger, please? They move evenly, and the one didn't stray from the other as I moved my finger. So next thing I'm going to do is check your ears. So I'm looking at the helix, which is the top part of your ear, the tragus, which is like the inner bump part of your ear, and I'm checking your lobule too for any discoloration, but I don't see any. It looks tan. I'm checking for any discharge in your ear. I don't see any. And I'm checking for any lesions on your ear, but I don't see any of those either. So now do I have permission to touch your ear?
Yep.
Thank you. Let me know if you feel any tenderness while I'm doing this. No tenderness? Awesome. Now can you turn your other ear to face the camera, please? Thank you. I'm going to do the same thing on this side. I'm going to check the helix. I'm going to check the tragus, and I'm going to check the lobule. And I don't see any discoloration over here either. I don't see any discharge. I don't see any lesions around the ear here. Thank you. So I have permission to touch your ear this time?
Yep.
Thank you. I'm going to feel your helix, tragus, and lobule. Does it feel any tenderness there?
Nope.
Alright, now I'm going to check your mastoid processes. Do you feel any tenderness while I'm doing this?
Nope.
Alright, I didn't feel any swelling either. So now I'm going to check your nose. Actually, I get my pen light out of my pocket. Thank you. Do you mind looking up for me, please? Thank you. So I'm going to check the left nostril first. I don't see any redness or inflammation in there. I don't see any discharge. It just looks pink and moist in there. And on this side, I don't see any discharge, inflammation, or redness. It just looks pink and moist on that side too. Thank you. Put this in. Do I have permission to touch your head?
Yep.
Thank you. I'm going to check your frontal sinuses and your maxillary sinuses. Was there any tenderness when I was doing that?
No.
Perfect, thank you. So next I'm going to check the inside of your mouth for me. Can you open up your mouth for me, please? Do I have permission to touch the inside of your mouth?
Yep.
Alright, I'm going to use my tongue blade to push down on your tongue while I'm looking. I'm checking the buccal mucosa, the soft palate, the gums, the teeth. So like the buccal mucosa, soft palate, and gums all look pink. There's no redness or lesions or abnormalities in the mouth, and the teeth look white. So next thing I'm gonna do is, can you stick your tongue out for me, please? I'm gonna check your uvula, and it doesn't look swollen or inflamed, it just looks pink and moist. And your tonsils, I would grade a 0. Thank you. So I would throw this in the trash after, but I don't want to throw away our knife. And then I'm going to check your jaw, your temporomandibular joint. Do I have permission to touch your head?
Yeah.
Thank you. Can you open your mouth like this for me, please? Can you do that a couple times? Thank you. I don't feel any crepitation. I don't feel any swelling. It seems like you have the full range of motion there. Was it tender when I was touching it and you were moving it?
No.
Perfect. Thank you. Do I have permission to touch your neck for me?
Yep.
Thank you. So I'm going to feel for any swelling or abnormal masses in here, and I don't feel swelling or abnormal masses. So there's your assessment, and after that I would make sure the patient is comfortably in their bed. I would make sure that they have all their items in the call light close to them. I would raise the bed rails ×2, and then I would document all my findings.